everybody, it's the Good Doctors here for today's Good Doctors Diagnose. It is Monday, August 17th.
How? We don't know,
Sure.
but it is.
Sure. I believe it because that's what my phone tells me. And, we spend a lot of time talking about leadership. It's one of our core guiding discussion principles here at Abbey Research. And there's been some interesting examples happening around the world, but particularly here at home as we transition into the next academic school year and looking at all the possibly different ways we can teach our children and teach them safely during a pandemic. And so that's what we're going to talk a little bit about today, some examples of leadership that Dr. Kristen has some thoughts and feelings
about. So because there has not been a national standard put out of how any schools should behave, K through 12 through higher ed, every school or district or whatever is kind of left to figure things out for themselves. And so we're seeing a very disparate action. Schools in Pennsylvania, for instance, pretty much have been told that they're online for a certain, until I think October at this point, whereas schools in Mississippi went back in person already. And we already have, I think it was within the first week, they had 100 students in quarantine in one specific school district.
Yeah.
So this weekend was move-in weekend for the first phase of move-in weekend for several universities, large universities around the country. Some universities were phasing students back. A couple of universities have canceled in-person classes completely, and they're entirely going online. Everyone kind of has a bit of a different thing, and we're of the generation that some of our friends actually have kids going to college this year. And I feel like I spent my weekend with petrified parents who were getting text messages from their kids that things like parties were still being allowed to happen. And social distancing was not being enforced. And the RAs were told not to worry too much if students were not wearing masks in common areas of dorms because they don't want to really make it, they don't want to ruin a kid's college experience. I've heard of stories where universities have tried to lobby their towns to still let them have things like homecoming. Even though the town has ordinances that no more than 10 people can gather, the university seems to think that they're special and that they should still be allowed to have homecoming. And I respect that universities need to make money. Just in case you were wondering, higher ed in the United States has largely been profit driven for a little while now, even at nonprofits, simply because of how the structure of federal funding has worked for a long time. And that's a broad statement that has a lot of nuance, but budgets are incredibly important to universities. And they are fundamentally a business. They are a different kind of nonprofit. Yes, absolutely. They have to educate your kids, but they got to keep the lights on. And keeping the lights on is really expensive because they definitely have employees that there's a large income disparity at most American universities. And they've promised quite a lot of higher education deans quite a large salary in some ways. And so they have to kind of keep this going. On that, we've heard several stories from universities around the country where the deans have publicly said they're going to be cutting back staff, but that no dean at that university has agreed to a pay cut. We saw this in Major League Baseball. We're seeing this kind of thing a lot where, there's not a lot of money where our mouth is going on right now. There's definitely some. I know of businesses where their CEOs have taken pay cuts. I know of family businesses where the family isn't getting paid until all their employees do. There's lots and lots of people that are doing it, but right now we'd like to focus on universities. Universities have a sacred right and a legal right to be in loco parentis for any student under the age of 18. And for your incoming freshman class, the average is that about 20% of your incoming students are going to be under the age of 18. Most of us turn 18. I entered college as a 17-year-old, and I moved to Kentucky as a 17-year-old. And so my university was legally responsible for me for the first 6 weeks of the semester. That is a very, very intense legal right that I am concerned that universities are abdicating on a certain level. I think there are some universities that are being incredibly careful. We work with a small university in South Carolina that is being incredibly careful and very intentional, but some of these larger universities, perhaps it is hard to do things like police parties. But when you have campus security show up to those parties and then campus security not breaking up those parties, when you have mixed messaging from your residence hall that, you know, the masks aren't really that important because it might ruin someone's college experience. You know, it's very difficult for a lot of students emotionally who perhaps have been sequestered their whole semester or their whole summer because they have been following the rules, or they have family members who are immunocompromised, or they themselves are immunocompromised. And this is a real, mixed messaging is always a problem, but when it's literally a matter of life and death, it's a crisis. And so we're hoping that at your organization, you are being very clear and the rules are being unilaterally enforced, and that there is that there is unity around why we are doing the things that we are doing. So that's our little moment for the day on that.
It's certainly, you know, a lot of people are being forced into public health positions that aren't public health experts,
Yes.
because of this lack of national guidance and cohesion. And it's certainly a very difficult place to be in, but it is alarming to us to see people in positions of leadership that are not prioritizing public health, or that are prioritizing profit over public health. Understanding that it's very, very difficult for a lot of businesses, and that universities are businesses. They are also, as you pointed out, still in this very important position of responsibility for young people whose brains aren't fully developed.
They are not, bless them.
Bless them. So some food for thought, whether you have college-age kids or not, we're all in positions where we're trying to make these public health decisions. So we encourage you to think about what are your motivating factors in making those leadership decisions and organizational decisions. And that is our Good Doctors soapbox diagnose for today. And we'll see you guys on Wednesday.
Wash your hands and wear your masks.